Hey coders, let's talk about the difference between new and established patients per the evaluation and management guidelines in the CPT. Let's talk about why it's important, how does this impact billing, what are the CPT guidelines, and let's talk about some common scenarios that can be confusing. First off, the why. Why is this important? Knowing the difference between new and established patients can prevent denials and delayed payments. The work RVUs is higher for new patient along with the reimbursement. So if you bill for a new patient visit and it's truly an established patient, this could result in a denial and delayed payments. However, if it is truly a new patient and an established patient visit is billed, this could result in a denial or reduced payments. Let's talk about what the CPT guidelines say in regards to a new patient versus an established patient. A new patient is one who has not received any professional services from a physician or another physician of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. An established patient is one who has received professional services from the physician or another physician from the exact same specialty or subspecialty who belongs to the same group practice within the past 3 years. So if the patient has been seen by a physician in the past 3 years, then that would be considered a established patient visit. If they haven't been seen in the past 3 years, it's a new patient visit. That's a simplified version of the concept, but let's talk about some scenarios that could occur that could be a bit confusing. So let's just say there is a physician practice and they have some other qualified healthcare professionals like a nurse practitioner or an APP. Per the CPT guidelines, a provider that is an other qualified healthcare professional is considered in the exact same specialty and subspecialty as the supervising physician. So for example, let's just say we're talking about a nephrology practice and the nephrologist sees the patient. It is a new patient visit, and let's just say the patient comes back in 6 months and then they see the physician's APP. In that case, it would be an established patient even though this is the first time that the APP is seeing the patient. Another scenario that might be a little bit confusing is hospital patients. Let's just say, again, we're talking about a nephrology practice. A nephrologist sees a patient in the hospital. Then that patient is discharged to their nephrologist's group practice and sees one of the nephrologist partners in the outpatient setting. In that scenario, it would not be considered a new patient visit because the patient has already seen the nephrologist in the hospital and they're seeing the nephrologist partner who is in the same specialty and subspecialty and group practice. So it would be established. Another scenario that might be a little bit confusing is, let's just say you work for a practice and it is a multi-specialty practice. Let's just say a patient, like we talked about, sees a nephrologist in this practice. But let's just say then they see an endocrinologist who's also in this practice. When they see the endocrinologist, they would be considered a new patient because even though they've seen a provider that's part of the same practice, they're not in the same specialty and subspecialty. So it would be considered a new patient. Another thing to note is that in the emergency room, there is no difference between new and established patients. So that's something to be aware of. This concept would not apply in that setting. All right, coders, so let's sum it up. A new patient is a patient that hasn't received face-to-face professional services in the past 3 years from a provider or another in the same specialty and subspecialty in the same group, while an established patient has. Stay sharp, coders.